Good evening. I'm Burrough. I'm happy to be in a group with Nicole Webb, with Stacey Causey, and Brandy Rambin. And I'm glad to have joined them in doing a concept analysis on disability. Okay, so we're going to talk about disability. First, let's talk about the background of disability. What exactly is disability? Historically, disability has been viewed in many different ways. There's been three main models that talk about the meaning of disability. Your moral model, your medical model, and your social model. Your moral model associate disability with sin, thinking that those that are disabled is a punishment from God. And this is kind of even though this is an outdated model, it's still one of the most popular ones globally. More popular in the United States is your medical model, which it summarizes disability to be some sort of bodily problem, some kind of bodily defect. And that's more, you'll hear more about that one in the United States. And also, it feels like disability is something that has to be cured. Okay? Now, your social model views disability as a social issue and that society is really not accommodating to the disabled. So that's kind of historically where we were. Now, more recent conceptualizations of disability discard that belief that the disabled are the oppressed. Okay? And they've come more together to help disabled people to reach their full potential. Okay, now what is the significance of disability? What's the significance of disability to us as nurses? Well, as the number of Americans without health insurance increases, the number of disabled increases, which just, kind of makes sense, that correlation. Less health insurance, less treatment, more disabled. So as nurse practitioners and nurses in general and healthcare providers in general, if you're going to have more disabled people, it's going to be more of a burden on the medical profession. So I think that's the significance to us nurse practitioners. Let's talk about the meaning of disability in published works. We've got three different published works here we're going to talk about. The first one is the American Association of Intellectual and Developmental Disabilities. They played a large role in getting rid of words like cripple to describe the disabled, or as far as physical disability, and gotten rid of the word mental retardation to describe those that have some sort of mental disability. So the American Association of Intellectual and Developmental Disabilities, here's an example of a meaning of intellectual disability. Here's an example: as when individuals function 2 standard deviations below the normal standard deviation for their age. Okay? Here's another example in a published work of the meaning of disability: workmen's compensation. Their guidelines represent the meaning of disability as the inability to carry on their functions in the workplace with their occupation, and injury or illness to the body. And then in a journal article, Vesselinova describes the concept of disability as being a physical or a mental impairment that has long-term effects on the individual's ability to engage in their normal day-to-day activities in normal life. Now let's talk about the purpose. We'll talk about the general purpose for concept analysis, and then we'll talk about our purpose. Some of the purposes for reasons for concept analysis is to set boundaries to attain a more structured framework. This keeps you from going out in so many different directions, more organization there. Also, clear conceptualization makes measurement easier, and that's going to really be important when it comes to research. You got to have some measurement going there. It also helps to create hypotheses, to frame nursing diagnosis, and develop databases to aid in making clinical decisions, which is going to be very, very important to all of us as nurse practitioners. And so, but what is the purpose for us in these are general purposes, but what's the purpose for us in concept analysis? Okay. The concept analysis of disability gives us a better understanding of disability. A better understanding of disability helps us to care as nurse practitioners or any healthcare provider to better care for the disabled.
Next, we'll be discussing the definitions and defining attributes of disability. The World Health Organization came up with a definition of disability, including limitations, stable limitations that were set out that patients had to go through more of a diagnosis rather than dealing with functionability. However, over time, they have evolved to include functionability of the patient and other attributes that are tied in with the disability. So now the term has become more of an umbrella term that covers many areas. Some of the main areas that are covered are under disability are impairments, activity limitations, and participation restrictions. With these, your impairments are bodily functions as far as patients that maybe don't have a limb. Other things are activity limitations, maybe an asthma patient that can't necessarily proceed and do the physical activities that other kids can do. And participation restrictions, again, different things as far as cardiomyopathies, maybe a patient that can't perform a full day's work, 8-hour shift. After looking through several different definitions of disability, our group has come up with a conceptual definition for disability, including several factors. One, that there must be a deviation to the physical or cognitive abilities of the patient. Next is that and there must be some kind of disturbance to the patient with their functioning of their daily task, their daily activities. And then a third area is that how long this disability is in effect for that patient, whether it be chronic or acute onset, and as far as what the patient is going to have to either adapt to this disability, or if they just need to make moderate lifestyle changes.
Next, we're going to discuss the cases. We have included some fun cases for the next upcoming presentations. The first case that we'll talk about is the model case, and we picked an example of a physical disability. To define a model case, it can be considered, it gives an example of a concept that demonstrates the defining attributes of that particular concept. We gave an example of a football player. In this case, Michael has played on the Northside University's football team in college. He played on the defensive line, where of course there is a lot of maximum physical contact. His sophomore year, during a tackle, he sustained a neck injury that involved and resulted in a subsequent paraplegia episode. He did do rehabilitation, was hospitalized, and went through a lot of trauma. But 10 years later, Michael is really about the same. He is unable to use his lower limbs. He has a customized wheelchair. Of course, the only way that he is able to enjoy football from here on out is to be able to watch it on TV. He requires 24/7 dependency care from his caregivers. And of course, his doctor has claimed that he is permanently physically disabled relating to this event. So this is our case of physical disability. For the related case, we chose the topic of impairment. Impairment, or better yet, a related concept is kind of related to the concept that we are studying. It's connected or correlated to the topic, but it doesn't have all the defining attributes of that particular concept. Let's talk about the case that we have here. Mr. Bernard has worked in the electrical business for 27 years. He has a lot of experience with that. But after about 16 years ago, he had to have his right arm amputated due to an electrical shock. Now Mr. Bernard continues to work, and he manages his crew of his own electricians. So therefore, Mr. Bernard, his impairment did result in an inability for him to return to his job of injury, but he was able to compensate. Mr. Bernard was able to adapt to his limb loss. He was able to modify his position at work and continue his employment, and also he conquered most of those activity of daily limitations that caused him such disability in the first place. So this particular case of disability is more related to one area or one intercorrelation of disability, which is impairment. The next case is a borderline case. This is an interesting case. A borderline case is usually an instance where metaphoric or pseudo applications of the word come into play. For example, when our group talked about the word disability, not only did a loss in functional capacity come up, we also talked about wage compensation and money related to the term disability. So hence we came up with the topic of disability wage compensation for our case. Also, I want to add in a borderline case that the word is used in a different context, like we just said. Nancy is recovering from an acute MI, and she had cabbage ×3. She progressed well. She did not have any complications. 2 weeks after being discharged from the hospital, she returned to see her cardiologist. At that time, even though she was doing well, she discussed with her doctor that she thought that she was no longer able to work because she had a bad heart in the first place, and related to her MI. She asked the doctor to fill out disability paperwork so she could get wage compensation to pay her bills. Therefore, in this instance, Nancy related disability to wage compensation. In this case, we're going to be talking about a contrary case. A contrary case, to summarize in my own words, would be something that is totally different than the concept that we have, that we are using. For an example, when we think of a woman having a normal pregnancy and a normal birth, it is totally not in the same relation as disability. So our example would conclude a case that Jenny is a 24-year-old pregnant. She's a 24-year-old pregnant with her first child. Her pregnancy has been uncomplicated the whole 9 months. She did have some mild nausea and vomiting through her first trimester, which is pretty common. She had a baby boy that was delivered via vaginal birth, and the baby had very high ABGAR scores. Jenny labored well with no tearing and minimal blood loss. She and the baby did go home real soon after the delivery. She returned to the doctor about 2 weeks after birth. Jenny did complain of some fatigue when she returned to the doctor's office. He did tell her that it was due to lack of sleep and having a newborn. The baby had gained 1.2 pounds, and the doctor did say that he wanted to continue the same treatment for the mom and the baby, relating to that this is a total contrary case to disability because it was a normal pregnancy and birth. Next, we have the invented case. The invented case was also fun to make up. To explain, an invented case is something that contains ideas outside of our own experiences. They are useful when examining a familiar concept. We used canine injury to give an example of our invented case. Bailey is a 3-year-old Yorkshire Terrier who is very curious. While crossing the road to visit her neighbor, she unfortunately was hit by a car. She sustained a broken sacrum and a dislocated femur. To repair that, she had to have 2 extensive orthopedic surgeries. Bailey, after surgery, was unable to walk or lift her tail to defecate. Therefore, she became more dependent on her caregivers. She becomes partially temporarily disabled and becomes cage-bound until she recovers from her surgery. This case being an invented case because it is a canine injury, which is outside of our own experiences.
Next, we'll be discussing the antecedents to disability. Antecedents are factors that come before the actual disability takes place, before it's actually formed or before it takes effect to the patient. Antecedents, there's numerous areas of antecedents, being genetics, infection, accidental, acquired, unknown. To go in a little more detail of this to help explain the antecedents, would look at genetics. Patients that have diabetes, this is a genetic disorder. It can be very disabling for some patients depending on how well controlled they are and how well it's going to affect them as far as stopping during the day to check their blood sugars multiple times. Another is infection. That can be from a viral infection that possibly can cause cardiomyopathy. Again, the disability being caused from that viral infection. Next, we'll be talking about consequence. Consequences that come from disabilities. They occur after the disability is already there and the patient is affected by it. Some things, for instance, with the consequences, you can say sensory disabilities, patients with trouble with hearing, they may need hearing aids or surgeries or so forth, as far as vision impairment as well. Something to know about with consequence and antecedents is that, are very important to know, is that neither of them are defining attributes of the disability itself. These are totally separate. Consequence come after the disability and are not necessarily a defining attribute of that disability itself.
Empirical indicators, also known as empirical reference, are classes or categories of actual phenomena that by their existence or their presence demonstrate the occurrence of a concept itself. This is a definition given by Walker and Avant. Some indicators assess different types of patient groups, everything from the frail elderly to pain to functional status and dependency on caregivers. And then more of a general type of indicator can assess just overall assessment of treatment and healthcare effectiveness on a disabled patient. Some examples of empirical indicators used to assess disability include the Tilburg Frailty Indicator, and this one specifically looks at a term they refer to as the frail elderly. This is used in the growing population of elderly that we have and assesses their level of disability, and they can treat these patients better based on this indicator. The Roland Morris Disability Questionnaire is one that is used specifically to treat low back pain. And these two are both scales that are used more on specific patient groups. The last two here, the Care Dependency Scale for Rehabilitation and the World Health Organization Disability Assessment Schedule, are both used in a more general sense. The Care Dependency Scale looks at these disabled patients and their dependency upon their caregivers. And of course that can be something that helps the patient do better if they don't have such a dependency upon them. The World Health Organization Disability Assessment Schedule is something that can be used across lifespans, across age groups, cultures, genders, and of course also with specific types of diseases and health concepts and processes. The operational definition of disability refers to the characteristics of a concept while at the same time clearly describing the method of measurement. And the operational definition is specifically based upon that tool that is used. There are several different tools that can be used to describe disability and to measure it. And for example, one example that we spoke about earlier, the Roland Morris Disability Questionnaire. It uses a scale varying from small degrees of disability with a score of 0, meaning no disability, to higher ranges of disability with a score of 24. And those people would have the severe disability. And that's just one example of the many tools that there exist out there. Disability, after we have done this thorough concept analysis, is a term that is widely used across healthcare these days. This thorough concept analysis has led our thinking to change and to understand this general term of disability in a much better way. Nurses, nurse practitioners, healthcare providers in general should all have the capability of assessing disability and measuring it through the use of the indicators that we have seen and just understanding their patients in a better way. This will enable these healthcare providers to deliver much better quality of care for our disabled patients. This concludes our presentation of the concept analysis of disability. The following are our references.